Ebola virus disease, EVD, formerly known as Ebola hemorrhagic fever, is a severe, often fatal illness that affects humans and non-human primates. It is caused by infection with one of the viruses of the genus Ebola virus, which belongs to the family Filoviridae. The disease first appeared in 1976 in two simultaneous outbreaks, one in Anzara, South Sudan, and the other in Yambuku, Democratic Republic of the Congo, DRC, near the Ebola River, from which the disease takes its name. Causes and transmission. Ebola is caused by the Ebola virus, of which there are 6 known species: Zaire Ebola virus, the most deadly and responsible for most outbreaks, Sudan Ebola virus, Thai forest Ebola virus, Bundibugyo Ebola virus, Reston Ebola virus, and Bombali Ebola virus. Of these, only the first 4 are known to cause disease in humans. The virus is believed to be zoonotic, meaning it originates in animals. Fruit bats, particularly of the Pteropodidae family, are considered the natural reservoir. Humans become infected through contact with the blood, secretions, organs, or other bodily fluids of infected animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope, or porcupines found ill or dead in the rainforest. Once a human is infected, the virus spreads through human-to-human transmission via direct contact with the blood, secretions, or other bodily fluids of infected people, as well as with surfaces and materials, like bedding and clothing, contaminated with these fluids. The virus can also be transmitted through handling of bodies during burial practices without proper protection. Symptoms. EVD has an incubation period of 2 to 21 days. People are not infectious until symptoms develop. Early symptoms are nonspecific and can resemble those of other diseases like malaria or typhoid fever. They include fever, severe headache, muscle pain, weakness, fatigue, sore throat. As the disease progresses, symptoms become more severe and may include vomiting, diarrhea, abdominal pain, rash, impaired kidney and liver function, internal and external bleeding, example from gums, eyes, or in stool. In severe cases, death usually occurs due to shock from fluid loss and multi-organ failure. The case fatality rate varies by outbreak but can reach up to 90%, depending on the virus species and availability of supportive care. Diagnosis. Diagnosing EVD in its early stages is difficult due to the nonspecific nature of early symptoms. However, if a person has the symptoms and potential exposure, several laboratory tests can confirm Ebola infection. These include reverse transcriptase polymerase chain reaction, RT-PCR, antigen capture detection tests, serum neutralization tests, enzyme-linked immunosorbent assay, ELISA, virus isolation by cell culture. Due to the high risk of laboratory exposure, these tests are only performed in specialized facilities with high biosafety levels. Treatment and prevention. There is no specific cure for EVD. Treatment primarily involves supportive care to maintain body fluids and electrolytes, oxygen status, and blood pressure, and to treat any complicating infections. However, significant progress has been made in recent years. Several experimental treatments have been developed and used during outbreaks, including monoclonal antibodies like Inmazeb and Ebanga, which have shown effectiveness in reducing mortality rates. Vaccines have also become a major tool in controlling outbreaks. The RVSV-Zbov, ERVBO, vaccine has been approved for use and was employed successfully in recent DRC outbreaks through a ring vaccination strategy, where contacts of infected individuals are vaccinated. Preventing Ebola outbreaks involves avoiding contact with wild animals, using protective clothing when caring for infected patients, and employing safe burial practices. Public health education is crucial to inform communities about transmission risks and safe behaviors. Outbreaks and global response. The largest and most devastating Ebola outbreak occurred in West Africa from 2014 to 2016, primarily affecting Guinea, Liberia, and Sierra Leone. It resulted in over 28,000 cases and more than 11,000 deaths. This outbreak highlighted weaknesses in global health preparedness and led to renewed efforts in vaccine development, public health infrastructure, and international cooperation. Subsequent outbreaks, particularly in the DRC, have demonstrated improved response measures, including the use of rapid diagnostics, mobile laboratories, and community engagement strategies. Conclusion: Ebola virus disease remains a significant public health concern, particularly in sub-Saharan Africa where infrastructure and healthcare systems may be limited. While the disease is rare, it is deadly and can cause widespread fear and disruption. Advances in research, vaccine development, and outbreak response mechanisms offer hope for better control and prevention in the future. Continued vigilance, global collaboration, and investment in public health systems are essential to reducing the impact of future outbreaks.